there's been damage to small blood vessels in the brain, this therapy can literally help it create new blood vessels so we can get more oxygen, get more nutrients, exchange waste products, and it can actually start to function effectively again. My name is Dr. Ryan Best. I'm a naturopathic doctor here at Neurvana Health. Today we're going to be talking about transcranial low-level laser therapy, or transcranial photobiomodulation, as it's called in some clinical trials. The therapy itself is using a series of medical devices that use arrays with high-intensity red and infrared medical lasers. These are not cutting lasers. They don't damage healthy tissue. They don't sear the skin. These are lasers that will penetrate through the skin, through soft tissue, even through bone in the case of transcranial laser, to affect a given set of tissues that they're applied to. In the case of transcranial laser therapy, the tissue that we're affecting is the brain, the central nervous system. The therapy is interesting because there are a lot of different types of conditions, inflammatory conditions, vascular conditions, injury conditions that can occur in the brain, that transcranial laser therapy has some semi-unique and then some actually quite unique abilities to influence those problems, start to correct those problems, and therefore be able to improve symptoms for patients that are dealing with some of those issues. So some of these issues, I think some of the more important issues that we're going to be looking at here would be things like post-concussive syndrome, which frankly is a very common, poorly, I would say, recognized and treated condition in North America, but can be very impactful. So for yourself or any other patients who, friends or family members have had a concussion or a series of concussions, you'll probably be familiar with what some of the potential symptoms of post-concussive syndrome can be. So for years, for decades, the idea behind concussions was, just go into a dark room, take some rest for a few days afterwards, wait until the symptoms go away, and it's going to correct itself. Now, that's true for some patients, but what we've realized, and frankly, what professional contact sports have really made obvious for us in the medical community in the last couple of decades is that post-concussive syndrome can be a chronic disease, can be a chronic issue. A lot of people either after one concussion or a series of concussions will start to develop post-concussive syndrome symptoms. So what do they look like? For a lot of people, this is going to be primarily things like cognitive dysfunction, brain fog, memory issues, fatigue, which can be mild, moderate, or severe for some patients that are experiencing that, and mental health changes. Mental health changes are one of the more common symptoms. Unexplained anxiety, depression symptoms, irritability, and what we call emotional lability, just a kind of a more extreme fluctuation between moods that doesn't really fit the stimulus, why that may or may not be happening for the patient. The symptoms can also be non-emotional and non-energy related. The symptoms can be things like headaches, different forms of migraine disorders or headache syndromes that can develop and become chronic for people. Light and sound sensitivity can be something that starts to develop for a lot of patients over time. Neurological symptoms for some patients, pins and needles sensations in different areas of the body, hypersensitivity to certain types of pain or chronic pain syndromes. So what you can see from post-concussive syndrome is that the symptoms can be vast. And that's not an exclusive list. That's some of the symptoms that can occur with this. Post-concussive syndrome is an area where there isn't a lot of what we would call conventional treatments that are available for that. So if you went into your family doctor's office to talk about post-concussive syndrome, or you went into the hospital, if it was a more severe concussion, they might have done a bit of blood work. They might have sent you for a scan, an MRI or a CT scan to check if there was a major bleed or a serious event that had occurred from the concussion. And if there wasn't, you were probably sent home. Maybe given some pain medication, something to sort that out for a while, but there's not really much follow-up that's going to be done for post-concussive syndrome. This is where transcranial laser therapy can be really a game changer for a lot of patients. So what this therapy does is it will go after a few of the more common chronic problems that develop in post-concussive syndrome. So what's happening, and I won't go into too much detail on this, but I'm going to give a little bit of the physiology on this. What's happening on a physiological perspective for people that are dealing with post-concussive syndrome is usually going to fit into a few categories. The first area is going to be residual low-grade inflammation in the brain. So what happens in a concussion injury is you get a jarring effect. Remember, so your brain is kind of encased inside the skull. When that concussion action happens, even if it's a minor concussion, that brain is going to move inside the skull in a protected space, but it's going to impact parts of the inside of the skull architecture. And the brain is very, very sensitive to bruising and damage. But one of the first responses that your body is going to do to that is it's going to create an immune response. It's trying to heal up any damage that may have occurred inside that tissue. But one of the problems is that the brain, in a lot of cases, has trouble correcting inflammation once it creates it. So there's inflammation that gets driven by the immune system, by the injury itself, but that inflammation can persist for months to years in a lot of cases post-concussively. And the brain can't always fix that. One of the big things that transcranial laser therapy does really well is that it is a very aggressive localized anti-inflammatory. So those specific red and infrared lasers that are used that will penetrate through the skull, they will shut down and significantly diminish neurological inflammation that's present. And that's part of the mechanism of why people get symptoms in post-concussive syndrome, is that inflammation. Secondarily, one of the other problems that happens in post-concussive syndrome is that there is what we call microvascular changes. Micro meaning small, vascular meaning blood vessels. So what happens is our brain is one of the most vascular tissues we have in our body. It is really rich with blood vessels, large, medium, and small. We have a ton of vessels, very small blood vessels in all areas of our brain. And we need those functioning really, really well to exchange oxygen, supply energy molecules to that tissue. And without those energy molecules and oxygenation, we don't get proper function in the brain. What happens in a lot of post-concussive cases is that there is microvascular damage that shows up inside various areas of the brain. And depending on which areas of the brain have been affected by that concussion, that's going to often dictate which symptoms might show up for patients. That's why post-concussive syndrome can look quite different person to person. Different areas of the brain are going to be impacted differently by different injuries. So what happens there is that often if there's a major blood vessel compromise, this is what happens more in things like a stroke, where people have a major bleeding event or a major clot that restricts blood flow. That's a major blood vessel compromise that shows up. In post-concussive syndrome, it's usually small blood vessels that get impacted. And the challenge there is an MRI and a CT scan can't see those microvascular changes. That scan will show up normal and it will say your brain is quote unquote fine. But the reality is that doesn't necessarily mean that there hasn't been microvascular damage that's occurred. That can impact function, that can cause symptoms. One of the unique things about transcranial laser therapy is that it's one of the only therapies that we have randomized control trials, large-scale evidence to show that these lasers can stimulate a process called angiogenesis. And what that means is they can literally stimulate new blood vessel growth in areas where there's been damage. So there are very few medical therapies that have been proven to be able to do this. Transcranial laser therapy is one of the more aggressive ones that we have for this. So if there's been damage to small blood vessels in the brain, this therapy can literally help it create new blood vessels so we can get more oxygen, get more nutrients, exchange waste products, and it can actually start to function effectively again. So that's pretty interesting. One of the third areas, and this is a little bit into the weeds on this, but one of the third areas that's interesting is that the brain, when you have these types of impacts, that low-grade inflammation and microvascular compromise, problems with blood flow to those areas, what will end up happening is you end up getting what's called mitochondrial downregulation. So mitochondria is a throwback to kind of grade 10 biology for anybody who's familiar with this. Mitochondria are kind of the energy production factories in all of our cells. Neurons and brain tissue has more than most cells in the body do. They're really, really energy dependent because they do so much work for us. And so mitochondria, because of some of those changes, they often start to become negatively impacted by those changes, and they stop making as many energy molecules. One of the really cool things, again into the weeds here, but one of the cool things about transcranial laser therapy is that those specific wavelengths of light that we're using, red and infrared lasers, they will directly stimulate mitochondrial activity. If anybody really wants to dig into this, there's a whole kind of field that you can read about how these lasers can actually impact mitochondrial output. But the nitty-gritty and the long and short of it is that stimulating mitochondria with these specific wavelengths of light will cause those mitochondria to become more aggressively active in making energy, which means a cell can heal. A cell can do its functions properly. The brain tissue can start to come back online. Secondarily, it stimulates mitochondrial biogenesis, which basically, fancy term for saying that we can make more mitochondria in a tissue to make more energy overall. So these are kind of some of the main mechanisms that transcranial laser therapy works through overall. So what's the process like with transcranial laser therapy? So typically what you're going to be doing, you'll be coming into the clinical center for treatment with one of several of my trained laser therapy technicians here. What we'll be doing, so there's a room set up for this. You got a nice cozy room with a reclining bed to yourself. A lot of my patients will just kind of use it as quiet me time. A lot of my moms and dads kind of love it because they get a little break from the kiddos. But you're going to be in and out of treatment in about 45 minutes. These treatments are comfortable. During the therapy, you should not be feeling any significant negative side effects during the therapy. Some people will notice during the treatment that they notice a bit of a heat sensation over top of where the arrays are applied. This is a medical device that actually has a series of medical arrays that are applied in sequence over top of the skull and the cervical spine. And so that's what allows us to actually push that laser energy into the neurological tissue itself. Okay. Like I said, during the treatment, very comfortable. Most people are feeling great while they're getting the therapy. Side effects from this therapy are typically pretty self-limiting in most cases. There's no documented serious negative adverse events, and this has been tested in tens of thousands of patients in clinical trials. We can back that up in my clinical center where we've treated well over 1,000 patients as well, not seeing any serious negative adverse events. If there is side effects, they're typically going to fit into what we call the transient category. Transient meaning that they are going to typically show up, they might last for a few hours, maximum maybe a day or longer than that, and then they're going to self-resolve over time. They typically fit into 3 or 4 categories. Most common side effect, and this is going to be about 20 to 30% of patients that are using the therapy, is going to be what we call transient fatigue. Some people will notice when they come in for the treatments that directly after the treatment for a few hours, they're going to feel more tired after this. This is kind of pushing your brain to do a lot of repair work. When it does this, that takes energy. And so it's very normal. We tell most patients when you're coming in for the therapy, just don't plan anything really aggressive or energy intensive after the treatments directly. Give yourself a little bit of a break so you can take some rest if you need it, okay? Over time, what's interesting is in between the sessions, typically energy tends to improve over time for people. Energy scores will climb, but it's directly after the treatment sessions that there might be some minor fatigue that shows up. Secondarily, and this is actually usually only going to show up in people that already have headache disorders when they're coming in, there is a small chance that we can actually precipitate or cause a small headache when you're coming in for the first couple of sessions. This is usually easily managed with over-the-counter therapies or prescribed therapies if that's already has been set up for you by your medical team. We can typically mitigate those without affecting the effectiveness of the laser therapy, but that's a small risk. It's only about 10% of patients who already have headache syndromes that they could experience a headache after those treatments. Third thing that we watch for, and this one's even less common, it's less than 4% of patients, but this is dizziness and lightheadedness. Same thing, it's self-limiting, it does not persist long-term, but there are several cases where patients will notice that they feel a bit dizzy or lightheaded. We'll keep patients around after these visits. My technicians will be checking with you to see how you feel after these visits, and if you do feel dizzy or lightheaded, we're just going to keep you in the clinic for a little bit to monitor, wait till it goes away, which it's usually going to go away pretty quickly on its own, and then we're going to send you home after those treatments. But like I said, the safety profile is excellent from this therapy. Usually when we talk about the number of treatments, because this is another common question, this is going to be a little bit different patient to patient. But typically what we're going to do is we're going to start with a round of 8 treatments. And these are usually going to be done depending on the condition that we're treating. Like we said, some of the more common conditions, post-concussive syndrome and post-stroke recovery are going to be big ones for this. Really great evidence on that. Most patients, what we're going to be doing is we're going to be doing a series of 8 sessions. It's usually going to be done on a sequence of once or twice a week. But for some of our out-of-town patients, I treat patients from all over the province, actually in all over the country as well too. For patients that are coming in from out of town, we'll end up organizing what we call a treatment intensive. So that's where they're actually going to come in and they're going to do 4 or 5 treatments back to back in a given week. We're going to send them home for a week to 2 weeks. We're going to follow up on symptoms, and then we may have them travel back for one more treatment round where they do the same protocol again after that. Patients in town once or twice a week, and we're going to be doing that for a period of 8 sessions. After that 8th session, we're going to be meeting to discuss what we've seen symptomatically, what has changed, how much has it changed, have certain symptoms completely resolved, have all symptoms completely resolved, or which ones are maybe not changing as much as others. So the response and how much response we get in certain symptoms is going to dictate, A, are we going to organize some more therapy? Are we going to do some more treatments? How frequent would that be? Because the long-term goal with this treatment, when it works well, For example, with post-concussive syndrome and a stroke, as long as those events don't recur, as long as we don't have another concussion or another stroke that happens, we can typically resolve a lot of these symptoms. We are correcting problems that should not be coming back when we heal them. So the goal is to wean patients slowly off of the therapy and eventually get them off the treatment completely once we've achieved the healing and recovery that we're looking for. So the long-term scale will depend on which treatment we're using, which condition that we're treating, how that patient is responding. But some patients, and I love when this happens, some patients are kind of the really aggressive responders. We get them through 8 sessions and we've resolved their symptoms. They're gone. And there's no more need for further treatment at that point. Those are the best case scenarios. So another common question that I get is, how are we going to track progress with these treatments? There's actually going to be a few different methods that we're going to be using, what we would call subjective and then more objective reports that we're going to use. So subjective things are going to be obvious. We're going to be taking pre-treatment symptom scoring, okay? And so that's where we're going to be having a detailed chat to determine what are all the symptoms that we're looking to target, how severe are they, how frequent are they, which treatments have helped and haven't helped for that. So we're going to have a really good baseline understanding of where we're at before we start therapy. Then subjectively, we're going to be following up at given points in time to check in to see what we're noticing, what you're noticing from a treatment perspective, what is changing and how much it's changing. 2 other things that we're going to be doing in that period, we're also going to be using what we call objective symptom scoring questionnaires. So this isn't used for all conditions, but certain symptoms, especially harder to track ones like energy, anxiety levels, brain fog, things like that, they can be hard to report, especially over long periods of time. A lot of my patients will say, "Doc, I remember yesterday, I remember Monday, but I don't really remember last week and I don't remember a month ago." So these objective scoring questionnaires are done before we start treatment, and then they're done at intervals as we do treatment, because they can actually objectively score the level of severity of different symptoms based on validated symptom scoring questionnaires from clinical research. So they can really help us be a bit more objective about tracking these changes. And then the third thing, the most objective tracking tool that we have is something called a quantitative EEG, or a qEEG for short, or a brain map for even shorter. And what this allows us to do is, this is a functional imaging technique where we can actually measure and coordinate, understand communication between different areas and networks of your brain. So for example, if there's certain problems that are showing up with mood regulation, energy levels, sleep quality or ability to fall asleep and stay asleep, and several other problems, the qEEG can often give us as a baseline, tell us what kind of dysfunctional patterns are showing up in the brain. Same thing, we can rescan that in the future to then show we are changing those neural networks. We are changing the way that they're behaving and moving them into a more organized, optimized functional pattern. So that's how we're going to be reassessing the effectiveness of the therapy over time.